This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America. And at this 32nd annual clinical meeting of the college in 1984, we have Dr. Fred J. Hofmeister of Milwaukee, Wisconsin. Fred, you must have been a founding fellow of the college, were you?
Yes, I had that privilege, and I was delighted to become a member of the American College of Obstetrics and Gynecology.
Once you were in as a founding fellow, you obviously eventually became president. Tell me a little bit about your progression through college offices.
Well, I was originally section vice chairman, and then section chairman, which includes the state of Wisconsin, of course. I became district vice chairman and the chairman of District 6, which Wisconsin is a part of, passed on one day, and I was called by the college to become the district chairman. I served as district chairman for 5 years. I then became second vice president of the college. I became first vice president of the college, and ultimately, for the year of 74-75, I became president of the college. This has been a great honor, and though it was a great responsibility, it gave a great privilege to do good wherever I could.
Fred, today we particularly want to talk with you about two items. I think it's the general belief that two very important adjuncts to the college, that is the Junior Fellows and the Nurses Association, both arose primarily out of activities in the Midwest area, and of course the Midwest really does include District 6. Could we begin perhaps by you saying something about how the Junior Fellow organization came to be in the 1960s at a time when the college was perhaps 15 years old?
Originally, the great man of the college, John Brewer, created a residence program for the American College. District 6 was one of the great beginners of this residence program. The great factor about this was the fact that one day of our meetings was for the resident members of the college to present papers and discuss papers. And this was a great opportunity for them to expand their activities. Ultimately, the Junior Fellowship Program was created, and this Junior Fellowship Program was created in 1967.
Did this begin just at the District 6 level then?
No, because at the same time, there were some of the other districts, one of which was District 3, that started a residency program and ultimately Junior Fellowship Program.
So it was really then sort of a grassroots thing which grew up in the districts.
That's right. And gradually it became a national organization. Now, I'm going to appeal for individuals of the college, especially the individuals who are leaders in the educational program, to stimulate their residents to become junior fellows. See to it that their residents attend meetings both on a district level and on a national level, because, in my opinion, some of the great educational benefits that come forth from being a junior fellow is to learn not only about the scientific situation, but the college itself and the great benefits that can be derived from being a fellow of the American College.
When did the Junior Fellows organization go national?
The Junior Fellow organization went national in 1967.
So now it's been about 17 years' time or so. It seems to me that even today, as we look among the younger leadership of the college, we're seeing a number of people who've come from the ranks of junior fellows and have moved on to take increasing responsibility. Would you like to comment for me on that?
Well, I think we've had great evidence in that. For instance, Jenkins, who has written a book about junior fellowship, is one of the examples. Junior fellows such as Kemper's and many other throughout the country were junior fellows when I was district chairman, and they have progressed to areas within the college that make them extremely valuable from the angle of leadership and education.
Over this period of time, Fred, what are you most proud of about the Junior Fellows organization that you really helped bring into being?
Well, the big thing that I think should be emphasized is the fact that as a result of the Junior Fellowship organization, it is very, very important that they learn to communicate. And communication between the members of the college and the members of the Junior Fellowship program and even the Nurses Association makes this a very, very important factor, to learn to communicate and cooperate and help people.
Well, in addition to all the babies that you've delivered, and I guess perhaps the Junior Fellows, there's a pretty general belief that the Nurses Association also grew out of activities in District 6. So if we look on that as perhaps another baby you delivered, how did the Nurses Association get started?
Well, one of the big factors was that while I acted as chairman of the District 6, we had meetings of the nurses who wished to come to the district meetings. And one of those was in Omaha. And though we only had 23 nurses there, they were very enthusiastic about being permitted not only to meet as a group, but to meet with the fellows. And one of the things that I stressed, it isn't how I do it, how you do it, but how we do it, meaning that nurses and doctors should work together and communicate and understand and cooperate in the care of patients. And this was one of the sentences which was placed in the Nurses Association bulletin.
About when did this happen? When did these 23 nurses gather together with District 6 in Omaha?
Well,
how far back are we talking about?
We're talking about 1959.
That's really when the college was 7 or 8 years old. So this got an earlier start than the Junior Fellows organization.
Yes.
What happened from then on? We've gone obviously from 23 nurses then to something close to 20,000 now. How did it come about?
Well, there were many, many committee meetings which I attended, and many discussions between the American Nurses Association, the then called Obstetrical, Gynecological, and Neonatal Nursing Group, and ultimately, as a result of these organizations discussing objectives, out of this was born the Nurses Association of the American College of Obstetricians and Gynecologists. And this was a step forward which I believe can keep growing, because our entire goals, residents, fellows, obstetricians and gynecologists, and nurses, must be the welfare of patients and understanding the method by which this increased excellence of program can be attained.
I guess it would seem evident to us that those things should be true, but from the time you talked about in 1959, 10 years went by before NACOG officially got organized. There must have been some roadblocks along the years that took us 10 years to get the Nurses Association started.
That's right. There was the desire for each organization to be independent and be the ruler rather than the cooperator. And that's why it took a long time to understand. There were many arguments, there were many controversies, but finally everybody understood.
Was there opposition from other nursing groups such as the American Nurses Association or any of the others? Was this part of the delay?
That's right. That's why there were great arguments and great controversies, and the meetings were required.
What finally made it happen, in your opinion? What got the two groups together?
I believe that the union occurred as a result of finally communicating in a way that they understood that they had one goal: the welfare of the patient, and that they weren't trying to vie for honor and so forth.
Fred, you've been a leader with the college now for 33 years, and you were certainly much involved in activities in our specialty before that time that led up to the college. At this point, what are you the most proud of among the many things that you've contributed to our specialty?
I'm glad that I have had the privilege to do some things in our group, and one of the things that I really am pleased with is the Higher Educational Loan Fund help. The opportunity of having had the occasion to gather together a substantial amount of money which was placed at low interest rates to help individuals who needed help to complete their education and to continue in activities was one of the things which I have always been very happy with.
I think that's another important area related to the junior fellowship, and I'm certainly glad you mentioned it because it is another one of your accomplishments. With us today, on this day in 1984, Dr. Frederick J. Hofmeister. founding fellow, a senior statesman, past president, and an individual largely responsible for the organization both of the junior fellows and of the Nurses Association. Dr. Fred, we thank you.
Thank you.